Thank you, Rajesh. And I think my task is very simple because the management etiology and the investigations have all been covered. So I'll be basically talking to you about as to what are the mechanisms of iatrogenic dry eye. So basically, iatrogenic means when it is induced unintentionally by the medical treatment of a physician, and so there may be iatrogenic symptoms, and it can occur because of medications. It can occur because of surgeries, which could be refractive surgery, even could be squint surgery, and drug induced could be topical or systemic. It can also be contact lens induced, and all kinds of surgeries, ophthalmic and non-ophthalmic, can cause iatrogenic dry eye. Notably amongst these are refractive, cataract surgery, keratoplasty, and lid surgery. Then apart from this, conjunctival, glaucoma, vitreoretinal, strabismus surgery, even intracorneal ring segments. Cross-linking is supposed to cause dry eye, then botulinum toxin, cosmetic procedures, and the non-ophthalmic conditions are graft versus host disease. Now, in most of these cases, what happens is that either the patients are on the borderline dry eye, and this dry eye condition gets precipitated after these surgeries, or the patient just jumps the fence from being normal to being a dry eye patient. So drug induced could be because of various allergies, antiviral agents, notably acyclovir, which we use, decongestants. It is always best not to prescribe a decongestant like a nefuzoline with a lubricant, because they both are antagonistic in their action. One is causing dry eye, other is relieving dry eye. Then myotics, midriatics and cycloplegics, preservatives such as benzalkonium chloride, topical local anesthetics, and topical ocular NSAIDs, all of them will have some element of dryness. More so because these drugs also have preservatives. Then when we come to glaucoma, as such, the glaucomatous patients, they are in the age group where dry eye can occur because they are generally, it is diagnosed when the patients are old. And because of the medication itself, there can be glaucoma, and the prevalence of ocular surface disease in glaucomatous patients is almost 60%. So one has to be careful about these conditions. Then there could be toxic immunoinflammatory reaction because of the drug itself, or patient may be allergic to some component. Then there can be tear film instability because of the preservative which is used in the drugs. Now, the beta blocking agents are most notorious for causing the ocular surface disease, and apart from it, in fact, all of them have an effect on the ocular surface when given for a prolonged period of time. Preservatives are notorious. The most notorious of them is the benzalkonium chloride, and that is why more and more drops are coming out now, even the anti-glaucoma medications which are preservative free. And benzalkonium is a quaternary ammonium molecule with detergent activity, and if you see in the various molecular studies also, you can see that it causes apoptosis, and it causes changes at the molecular level. Then on the ConfoScan pictures also, when the studies were done comparing with and without preservatives, the ConfoScan pictures were significantly better in those cases where preservative-free medications were used, as opposed to where the preservatives were used. Now, this is again to show the same thing, that the inflammatory markers are much more where the multiple treatments have been given, as opposed to the ones where non-preserved drops have been used. Then contact lens is again notorious for causing dry eye, especially if it has been used for prolonged periods of time, and 50% of the contact lens wearers experience dry eye symptoms as compared to 21.7% of non-contact lens wearers in one study. And you can either have CLIDE, that is signs and symptoms of dry eye, during the contact lens wear, where signs and symptoms did not exist before the contact lens wear, or you can have a contact lens associated dry eye, where the existence of signs and symptoms are there during the contact lens wear. An important thing is that you should use daily disposable. The fitting lenses may contain internal wetting agents. The topical wetting agents can be used while inserting them, and there are special inserts, that is hydroxypropyl cellulose ophthalmic inserts, which have also been advocated. Then the treatment has been dealt by Dr. Sangwan very well. So you have to stop wearing contact lenses. Possible plugs may help. And this is a bit controversial, omega-3 and omega-5 fatty acids. Then surgeries are notorious to cause dry eye, more so the refractive surgeries such as the femto LASIK and the microkeratome LASIK, less after surgery such as smile, then cataract surgery, lid surgery, all of them can cause dry eye. Then dry eye signs and symptoms, they are present in almost 50% of the patients who've had LASIK, and they subside by post-op 6 months. And pre-op dry eye is an important factor which is considered as a risk factor for development of a chronic dry eye symptom after LASIK. Now, this mainly occurs because of the disruption of the intracorneal nerves, because of corneal sensitivity that decreases, which causes decrease in the blink rate and decreased tear secretion, ocular surface damage, and dry eye symptoms. Apart from this, the tear stability is also affected, which can lead to decreased TBUT, and this will be likewise also reflected in the Sharma values. And if you look at the confocal pictures also, they have very nicely shown that the corneal nerves do get severed when you're doing LASIK, whether femtosecond or conventional LASIK. And these are the pictures of the same over various follow-ups, and they start to regenerate. And at 6 months onwards, the regeneration occurs. Now, PRK would induce less dry eye as compared to LASIK, and SMILE would induce less dry eye as compared to LASIK, and this is attributed to sparing of the superficial nerve fibers. And there are certain risk factors. It occurs more when you've used mitomycin C, more with greater ablation depth, and when retreatments have been done. The treatment again would remain nearly the same, except that you can add topical cyclosporin, punctal plugs, autologous serum can be given, and treatment generally lasts for 6 to 8 months following surgery. Then even keratoplasty can cause dry eye disease, mainly because all the nerves are severed, and this takes about 1 year for the nerves to regenerate. And this has also been shown in the molecular studies and the studies which are done at the level of the histopathology. And cataract surgery can also cause dry eye. And again, because this is age group which is older age group, and also because this may just precipitate after you do cataract surgery, and various studies it has been shown to cause dry eye. Then flax and phaco can cause likewise, and ICC and ECC dry eye duration would be much more prolonged because the incisions are larger. And again, risk factors for this have been already described. And long microscopic light exposure is supposed to have adverse effect on these cases. And again, preservative-free lubricants, lid hygiene, topical cyclosporin, and topical diclofosol, which is not available in our country, can be given. Then apart from this, other surgeries also like pterygium surgery, squint surgery, lid surgery can also cause dry eye. And even following blepharoplasty, there were dry eye symptoms and chemosis. So one should know about it, one should be aware of it, and counsel the patient accordingly. Then glaucoma, vitreoretina, strabismus surgeries, and intracorneal ring segments, even collagen cross-linking and botulinum toxin can cause dry eye. Then of course, aesthetic surgeries, Botox is notorious for causing dry eye symptoms, and anything which is cosmetic such as this in the ocular surface can also cause it. Non-ophthalmic procedures are primarily the graft versus host disease, which can cause dry eye, and also Stevens-Johnson syndrome and other conditions where the patients are there for prolonged periods of ventilation. Now, there are a variety of tests for dry eye disease, and although they have been tested for cases which are not iatrogenic, but these have to be also standardized in cases which are iatrogenic. And one has to take prophylaxis in the form of drops, especially those cases which are sitting borderline. And to conclude, iatrogenic dry eye disease is a well-recognized entity and is generally underestimated. And there are different aspects apart from the toxic denervation, tear film instability, and inflammation. And treatment should not only be addressing the lubrication, symptomatic treatment, but also the underlying pathology, which could be denervation, inflammation, and other components of the condition which need patient understanding.